Hi guys, welcome back to HMS. I'm Tosin, and yes, it is good to have you back on our channel. Thanks for tuning in. I told you to watch out for the second part of the video we dropped earlier. Here it is, and today we'll be talking about taking clinical exams in medical school as well as oral exams. So which one should we do first? So, clinical exams, I don't know the type they do in your school, but my school, we do almost all types. We write long case for pediatrics, OSCE for O&G, surgery, medicine, then short case for almost everything, if you know what I mean. Preparing for long case is kind of different from preparing for OSCE. Preparing for OSCE is also different from preparing for short case. So they all have their peculiarities. So let's take it from long case. And long case is the exam where you get to clerk and present. I believe you watched the video where OJ talked about exams in medical school. If you haven't watched that video, click here to watch. Long case exam, you get to see a patient, you ask questions, you document your findings, and from that you make your diagnosis. So you have to clerk the patient, and then your examiner comes in, you present to your examiner. When you're done presenting, you'll be asked what your assessment is. You tell them your assessment, you tell them your plan, and the examiner asks you questions as it deems fit. So let's go to the things that you need to have for the exam, particularly for pediatrics. You should have your stethoscope, you should have your pen touch, you should have your patella hammer, you should have your matric number tag. That's like the first things first, because I remember one of the exams, long case end of posting we did, one of my classmates forgot to use a matric number tag. Instead, she used a name tag, and the examiner told her it was a malpractice. When she was saying it, I was like, really? For real? Yes, for real. So please don't forget to switch from name tag to matric number tag. You don't know the kind of examiner you'll be meeting, and just to, avoid unnecessary drama, just use your matric number tag. So matric number tag for exams, all exams that you'll be appearing, the types of clinical exams, orals, use your matric number tag. So you have your stethoscope, of course your word codes, which your matric number tag will be on, your matric number tag, your word code, your stethoscope, your pen touch, your patella hammer, your tape rule if you're in pediatrics, your diagnostic set if you're in pediatrics, and if you can get your thermometer, I think it would be good you also have your thermometer to avoid, going back and forth during exams, which will save you some minutes. Because in my school, I don't know about other centers, but here you clerk for I think about 45 minutes, then you present your case for 15 minutes, and in 1 hour it's a wrap. So 45 minutes kind of short to clerk, examine, and do all sorts. So you want to try and cut down on the time you spend walking around. So if you can go with your thermometer, even if you have your pocket spig, it won't be bad, so that you don't have to wait for someone to finish using the spig before you get to check your patient's blood pressure, So have those things in place. When you get to your patient, introduce yourself and tell them what you want to do, and seek for their cooperation, because some patients can be very, very dramatic and non-cooperative. So beg them that it is an exam and you need all hands on deck. Introduce yourself and do all that, then ask about the things that brought them to the hospital. All those details about history taking. If you don't, check your tests and see what it entails. So ask about the presenting complaints, clerk the presenting complaints, then go to other parts of the history. And when you're done, do the examination. Start with the general examination. If you're in pediatrics, take the anthropometry. And when you take the anthropometry, you're supposed to calculate the percentile in relation to the normal. So do all of that, take the vitals. Then the next system you should examine should actually be the affected system. Say your patient presented with chest pain or presented with cough, with wheeze, breathlessness. You should know that the first system after the general physical examination as well as the anthropometry and vitals should be the chest examination. So do that first, so that in case you're not able to touch other systems, you have at least examined the affected system. Do you get? So although it is important that you touch the other systems, you examine the other system, there comes the time when you get to present to your examiner. Greet the examiner and wait for instructions on how to take it further. So in all of it, try as much as possible to be calm and composed. I know that it is clinical exam, it is long case, it is subjective, it is this, it is that, but try as much as possible to keep your cool and, pull yourself together no matter what happens. So you've got it and you're going to scale through it. So that is that about long case exam. So let's go on to talk about OSCE exam. This is a part where the exams are in stations. Then you get to go around different stations. There's allotted time. Maybe, I don't know, maybe 1 minute, 20 seconds, 3 minutes in a station. Then you hear a bell, then you move. So when you get to that station, look at the question there, answer the question. In some departments where you don't get to write long case, you might get to a station where you might need to clerk a patient. Maybe Mrs. A.O. is presented with 3 days history of yellowness of the sclera, with 3 days history of fever and this. Then ask relevant questions. So you ask questions, and as you're asking that question, the examiner seated by your simulator is scoring you. Say you are supposed to ask for that yellowness of the eye, you are supposed to ask for history of pale bulky stool. If you ask, the examiner will score you. If you didn't ask, that means you didn't get anything in that question. So you ask the questions, and then maybe when you get to the next station, they get to ask you what is your diagnosis, then you write that. So it's in stations. There are questions there. When you get to those stations, please don't fidget. I've simulated for an exam before, and one of the people that rotated through that station was really fidgety. I'm sure it was something he knew, but he couldn't pull himself together, and throughout the 2-3 minutes, he couldn't ask any relevant questions. So please try as much as possible to be calm. Okay, thank you. Be calm so that you can think and, put your thoughts together and know what to do in each station. Then about the short case is usually instrumentation, probably take you around the world, put instruments on the table, tell you to write about it. Some might be picture tests. So they ask questions, say about the sphig now. They can ask you, what is this instrument? Sphygmomanometer. What is it used for? Used to check this. In what clinics are they important at? Nephrology, cardiovascular clinic. And they might not ask questions about what it is used for. Say for instance, the sphig, they might ask questions about blood pressure, what are the causes of high blood pressure, in what conditions can you have hypertension, and things like that. So just prepare generally for things like that in your short case. For another person, it might be that they'll take you around, e.g. pediatrics. A senior once told me, I've not written my exam, but a senior once told me that they can take you around the world, point to the television and ask you, what is this? Name it. What is the importance in pediatric practice? Yes, pediatricians are that weird. Ask you about television, ask you about curtains, ask you about the paintings on the wall, and all sort of really. That is that about short case, and I think by and large, that is that about clinical exams. So let's go on to talk about the Viva exam, or call it orals. Anyone, your choice. So for the oral exam, there's really nothing much about oral exams, really. The first things first, just like for clinical exam, is your appearance. Iron your watch coat, appear good, presentable, and use your matric number tag. don't use your name tag, your matric number tag. Please, again, your matric number tag. So when you get into the, oh yeah, my friend said I should tell you, OJ, that you should not wear perfume so that you don't choke your lecturer. Okay, so don't, even if you would want to smell good, don't use a really strong perfume that, you know how medical school is. The lecturer might say that it's because of the perfume that you are using that has entered into your brain and that's why you cannot remember stuff. So just be moderate, please. Use a mild perfume. Smell good, not awful, but don't smell too strong, if you know what I mean. Yes. Okay, so that's it about the appearance. Then when you get into the examination room, you have your examiners or examiner seated, and when you get in, greet them. Don't sit until you're told to do so, and when you're told to do so, you can have your seat. Please, it cannot be overemphasized. Be composed. When they ask you a question and you kind of don't know it, don't say that you don't know. Just say that you can't remember. You know, that way you are giving your examiner the impression that you actually did your homework by reading the things you needed to have read. It is just that at that moment you can't reproduce it because you cannot remember. Not that you don't even have an idea at all. Just say you can't remember and that you're going to check it up after the exam. Yes, and the examiner is going to move on and ask you another question. Another thing that you should note for oral exam is they might also have instruments on the table, pick up things and ask you to talk about it. Say normal saline or sample bottles, they might have it laid on the table, tell you to pick one thing and talk about it. You cannot say, so just prepare for things like that and yeah, you're good to go. And when you're done, thank them and have your leave. So that is that about writing clinical exams and oral exams in medical school. If you found these tips and tricks useful and guide useful, subscribe. And don't just subscribe, like the video, share with your friends so that they can also learn and apply these things in their exam. And also you should leave a comment. Remember always that even with the many exams that we have to write in life as medical practitioners, you can be happy. So you can be doctor and happy. Thank you so much for tuning in. See you next time. Bye.